Development of pharmacopoeia monograph for Tribulus terrestris grown in Sri Lanka. Tribulus terrestris is a well-patronized medicinal herb in Ayurvedic medicinal system. It is commonly used to treat genitourinary tract disorders, kidney stones, and sexual disabilities. Due to high demand, it is commonly adulterated by other plants. Although there are some specifications available in the Ayurvedic pharmacopoeia, they are not strong enough to cope with today's quality control problems, as it does not contain any scientifically based standards. Therefore, it is necessary to develop standards which help to quality control of herbal medicine that guarantee the consistency in composition. This research is an attempt to develop standards to quality control of Tribulus terrestris in the revised pharmacopoeia. 3 samples of Tribulus terrestris have been collected from Galgamur, Galkulama, and Tabuttegama and got authenticated. Morphological, microscopical, and organoleptic evaluation done for all 3 process samples. Microscopical evaluation include powder microscopy as well as histological evaluation. Physicochemical tests have been done according to the test method specified in British Pharmacopoeia 2016. TLC, UV spectrum, and FTIR analysis have been carried out for the methanol extract of the whole plant for identification and characterization. TLC profile have been exhibit 4 major fluorescent spots for the chloroform methanol solvent system. Total phenol and tannin content of these samples also been evaluated. So, these results presented in this study will provide guidelines for designing the pharmacopoeial monograph for Tribulus terrestris. Thank you.
Free radicals are formed in our body as well as around environment. Free radicals can damage protein, DNA, lipids in our cells as well as leads to different disease and conditions. Also reduce shelf life of foods. Sri Lanka import antioxidant by expending large amount of money, but plenty of antioxidant rich sources are in our country. Terminalia verica plays major role in Ayurvedic medicine to cure various diseases and conditions. The properties and the antioxidant activities of Terminalia verica fruit extract have been shown significant differences with solvent as well as temperature conditions. High phenolic content was observed in non-heated ethanol ethyl acetate, while heated ethanol ethyl acetate showed highest flavonoid content, and the heated 75% ethanol extract showed reducing power, and the highest antiradical activities was observed in non-heated 75% ethanol. Normally, DPPH requires 30-minute incubation period, but these extracts are only required 6 minutes. It can be concluded that these are comparatively highest antioxidant with properties and the antioxidant capacities. So we can use these antioxidants in pharmaceutical and food industries. Thank you.
I am Devasagayan Pileshian, and our study focuses on the inhibition of in vitro induced Ig-independent rat basophil degranulation by pomegranate and green tea. Global prevalence of food allergies range from 3.5 to 5%. Food allergens cause allergic reactions and anaphylaxis with normal IgE levels. Therefore, pseudo-allergies occur where the reaction is IgE-independent and cause direct degranulation of mast cells and basophils. The objective of this study was to investigate direct IgE-independent rat basophil degranulation in vitro by selected food items and its inhibition by green tea and pomegranate. Foods such as hen's egg, beef, cashew nut, and crabs were taken, and their proteins were extracted and data quantified by Bradford assay. They were analyzed via SDS page. Inhibition of direct granulation were assessed with 1000 microgram per ml of green tea and pomegranate extracts on an RBL2H3 cell line. Compound 4880 was used as the positive control. As a result, the degranulation induced by food extracts ranged from 31 to 42% for egg, crab, and beef at 1000 microgram of proteins per ml, while 24% for cashew at 100 microgram of protein per ml. STS page analysis showed 16 known allergenic proteins in the food extracts. All food items induced direct degranulation were significantly inhibited by green tea. In addition, green tea and pomegranate extracts showed 86.3 and 84.5% inhibition of direct degranulation caused by compound 4880. As a conclusion, the selected food items used such as eggs, beef, cashew and crab had induced direct degranulation of red basophils in vitro in an Ig-independent manner, while green tea and pomegranate extracts have shown significant potential for inhibiting in vitro degranulation of red basophils.
Composite astringent index and the determination of anti-infective measures of selected folklore therapies. The astringent activity of materials is very much important property to investigate. Astringent activity is kind of chemical nature that having specific activity to shrink or coagulate protein within the body tissues. Usually, most of the astringent materials contain mild to high level of tannins as a prominent constituent. According to that, it is better to have a standard scale to determine the variation of astringent activity of particular astringent material, which in comparison to another astringent material. Therefore, we have decided to establish composite preliminary astringent index for astringent materials with respect to the tannic acid. On top of that, folklore anti-infective measures are mainly based on traditional medicine, which has been practiced by our ancestors throughout the generations. By completing this research, we hope to reveal scientific basis behind the belief of the folklore anti-infective measures and thereby to apply the best scientific method to ensure their use is safe, effective, and economical. In this research, we have planned to determine antidiarrheal activity of solution by titrating with different astringent preparations. Endpoints were determined when protein precipitation was completed using UV absorption measurements followed by bioweight test. To evaluate antimicrobial activity of black tea and black coffee infusions, experiment on growth inhibition by a reduction of colony forming units were carried out. As a result of this study, the strongest astringent activity was found with araloe extract and the weakest with coriander extract. Black tea and black coffee infusion showed a high percentage of inhibitory activity against both Escherichia coli and Salmonella typhi microbes. In conclusion, it can be stated that using astringent power of substances, the composite astringent index was established. It was clear that consumption of black tea and black coffee infusion during diarrheal state can achieve significant antidiarrheal effects. Thank you.
Hello everyone, I'm going to give you a summary of our research entitled Polymer-coated heparin-loaded haloside nanotube for modified release formulation of heparin and in vitro study. Current heparin administration is challenging due to several patient-related issues such as non-compliance, fear, pain, lipohypertrophy, and intravenous or subcutaneous administration. These challenges can be overcome by developing modified release polymer-coated heparin-loaded HNT composite. In the study, unfractionated heparin was isolated by ethanol precipitation method from intravenous dosage form. Then isolated heparin was loaded into HNT by vacuum evacuation. New Asian blue assay was developed for identifying and quantifying heparin. Entrapment efficiency was 44.72% and it was relatively high. Heparin-loaded HNTs were then spray-coated by both polyethylene glycol and hydroxypropyl methyl cellulose. Characterization was done by using FGIR analysis to identify physical interactions and to reveal the loading of heparin into HNT. According to in vitro release studies, the drug release from uncoated HNT composite followed passive diffusion and showed immediate release for 2 hours and delayed release for 24 hours. After the polymer coating, immediate release and delayed release were extended up to 4 hours and 48 hours respectively for both PEG and HPMC. We have 2 cells for live and dead cell assay and also cytotoxicity and cell proliferation assay using WST reagent to detect cells which convert WST1 to pink crystals corresponding for absorbance and measured by spectrophotometry. Human embryonic kidney cells were used for this assay. The study concludes haloside nanotubes are promising nanocarriers to formulate modified release formulation of heparin and further release is extended by coating with polymers and further revealed that they are non-toxic and well tolerable. Thank you very much.
Anti-adipogenic effect of ethyl acetate extract of Spondius pinnata stem bark and Gymnema sylvestre leaves in 3T3L1 pre-adipocyte cells in vitro. Obesity has become a major worldwide health concern, increasing the risk of diabetes, heart diseases and hypertension. Hence, the development of novel therapies using natural products has renewed attention in recent past. Accordingly, we selected two plants, Spondius pinnata and Gymnema sylvestre, based on their previously claimed anti-obesity activities to investigate their anti-adipogenic activities using 3T3L1 murine pre-adipocyte model in vitro. Plant materials collected from the western province of Sri Lanka were authenticated from the National Herbarium. Spondius stem bark and Gymnema leaves were washed, dried and ground well into a fine powder. Ethyl acetate extracts of these materials were prepared by Soxhlet extraction and evaporated under low pressure. Extracts were redissolved in DMSO. 3T3L1 cells were propagated in high glucose dalbocose modified Eagle medium. The cytotoxicity of plant extract were determined by MTT cell viability assay and a dose of 100 microgram per ml was selected based on their respective IC50 for adipocyte differentiation studies. 3T3L1 adipocyte differentiation was stimulated by a cocktail consisted of isobutyl methylxanthine, dexamethasone and insulin in the presence and absence of plant extract. After 2 days of incubation and every 2 days thereafter, the medium was changed to the second differentiation medium, which contained growth medium and insulin until intracellular oil drops were visible. The fully differentiated adipocyte was stained with oil redox stain and quantified spectrophotometrically. The results showed significant decrease in absorbance in cells exposed to the plant extract. Therefore, it can be concluded that tested plants can mediate a significant anti-adipogenic activity, validating the previous claims as anti-obesity therapy. Further studies are suggested to resolve the underlying mechanism of anti-adipogenic effect.
I am Jailani. My research topic is evaluation of in vitro antioxidant and thrombolytic activity of methanol extract of Allium sativum. Allium sativum, commonly known as garlic, is used as a spice and a flavoring agent. It has shown different types of pharmacological properties such as anti-inflammatory, immunomodulatory, and anti-hyperlipidemic activities. According to traditional medicine, there are many other medicinal values of Allium sativum. Therefore, objective of this study was to evaluate in vitro antioxidant and thrombolytic activity of methanol extract of Allium sativum. In this study, the extract was obtained by maceration of Allium sativum bulbs with methanol. This extract was used to evaluate antioxidant activity by hydrogen peroxide free radical scavenging assay method using ascorbic acid as a standard, and also to evaluate thrombolytic activity by proteolysis method using streptokinase as positive control and distilled water as negative control. Data analysis was done by one-way ANOVA at significant level of 0.05. According to results, methanol extract of Allium sativum has concentration-dependent antioxidant activity. There is no significant difference between scavenging ability of ascorbic acid and methanol extract in lower concentration. However, there is significant difference in higher concentrations. In proteolysis method, when comparing with positive control, there is significant difference between streptokinase and methanol extract, and also there is significant difference between negative control of distilled water and methanol extract. However, proteolysis ability of methanol extract is higher than distilled water at even lowest concentration. According to the results, methanol extract of Allium sativum has antioxidant activity which is lower than ascorbic acid and thrombolytic activity which is lower than streptokinase and higher than distilled water. Thank you.
Welcome to our poster presentation on phytochemical screening and evaluation of antibacterial activity of Hydrophila aqueous extracts against E. coli. I am Sandhani Karuparachi. Hydrophila shulli, also known as Neeramulia, is an important medicinal plant used in Ayurvedic medicine to treat various kinds of diseases, including urinary tract infections. In our study, we analyzed phytochemicals and evaluated the antibacterial activity of 3 different hot aqueous extracts of Hydrophila shulli plant against E. coli, which is the most common uropathogen. It was done by subjecting 60 grams of dried plant powder into boiling, Ayurvedic decoction, and the steaming methods. The phytochemicals were analyzed for each extract, and the antibacterial activity was tested using the Agar-Well diffusion method against the E. coli standard American type culture collection strain and 5 clinical isolates obtained from urinary tract infected patients. Then the extracts which showed an antibacterial activity were subjected to broth microdilution method to determine minimum inhibitory concentration. Moving on to the results, the highest concentration was found to be in the steam extract, whereas phytochemical screening revealed the presence of tannins, cardiac glycosides, terpenoids, and quinones in all the 3 extracts. In the well diffusion assay, only the E. coli standard strain and one of the 5 clinical isolates gave an inhibition zone for the steam extract, and for both the isolates, the minimum inhibitory concentrations were 0.6 grams per milliliter. In conclusion, out of the 3 extracts, only the steam extract had an antibacterial activity, as it likely contains active compounds in higher concentrations, and it could be a potential antimicrobial agent. However, more clinical isolates should be evaluated to confirm the antibacterial activity. Therefore, current data would serve as a basis until then. Thank you.
I'm Dilipa Saputantri. Our project is antimicrobial activity of Garcinia salinica extract chemically modified with titanium dioxide nanoparticles under different experimental conditions. The antimicrobial activity of aqueous extract of dried pericarp of Garcinia salinica modified with titanium dioxide nanoparticles has been reported. Titanium dioxide nanoparticles have photocatalytic activity when exposed to UV irradiation, enhancing antimicrobial activity. Our present study focuses on antimicrobial activity under different conditions of UV exposure of titanium dioxide modified Garcinia salinica. In methodology, as shown in figure, the plant extract was prepared according to the Ayurvedic protocol and characterized by UV visible spectrophotometer. One of the plant extract exposed to UV without treating titanium dioxide nanoparticle and other part exposed to UV with treating titanium dioxide nanoparticle for 0.5 mg per milliliter. Then these 14 samples were tested for investigating antimicrobial activity according to the well diffusion assay. All of the extracts show antibacterial activity against Pseudomonas aeruginosa and methicillin-resistant Staphylococcus aureus. And also, potential antibacterial activity increased with UV exposure time peaking at 20 minutes, but antifungal activity was not observed. UV irradiation of titanium dioxide modified Garcinia salinica aqueous extract demonstrated antibacterial activity and thus has potential to be developed as a surface disinfectant in the future after further characterization. Thank you.
Good day to you all. I am SLA Gunawardana from Faculty of Allied Health Sciences, University of Sri Jayawardhanapura. Our study is about analyzing the antimicrobial potential of different extracts of Mangifera salonica stem bark. The other authors of this project are Professor N.M.S. Sirimuthu, Dr. T.D.C.P. Gunasekara and Mr. M.A. Sirivardhana. Mangifera salonica, which is commonly known as atamber, is an endemic plant to Sri Lanka. This stem bark of this plant is used to treat several diseases. The objective of this study is to investigate antimicrobial properties of the stem bark extracted with 2 different solvents, methanol and water. The plant barks were obtained from Rambukkana and Galle area. These were then washed and air dried. Then the barks were separated into inner and the outer bark. These were then coarsely powdered and extracted into aqueous and methanol solvents. The solvents were evaporated and the solidified plant extract was obtained. Then from the solidified extract, a dilution series of 100 to 12.5 mg per milliliter was prepared. This dilution series was then subjected to well diffusion assay to investigate the antimicrobial properties against Staphylococcus aureus, Pseudomonas aeruginosa, Escherichia coli and Candida albicans. The results were obtained and measured the average zone of inhibition. According to the results, Rambukkana and Gall methanol inner barks gave the highest zone of inhibition against Staphylococcus aureus. Aqueous extract of Rambukkana outer bark showed the highest inhibition against Pseudomonas aeruginosa, and Rambukkana inner methanol bar extract showed the highest activity against Candida albicans. According to this study, the methanol extract of inner bark of Mangifera selenica had the potential antimicrobial activity against Staphylococcus aureus, and both outer and inner barks had comparable activity against Candida albicans and Pseudomonas aeruginosa.
Good morning, I'm Dr. Utpali Atakola from Colombo South Teaching Hospital, and the title of our study was The Consequences of COVID-19 on Teaching and Learning Methods and Attitudes of Online Learning Among Medical Undergraduates of the University of Sri Chavadhanapura. So the COVID-19 pandemic has impacted medical education globally, and online medical education was not previously established in our country. So with the closure of universities, the teaching methods were changed to e-learning. So the objective of our study was to describe the consequences of COVID-19 on teaching and learning methods and the attitudes of online learning among the medical undergraduates of the University of Sri Chavadhanapura. A cross-sectional web-based survey was conducted in October 2020 among all medical students, and total of 426 students responded to the online questionnaire. The response rate was 55.3%, in which majority were the females. Only 37% reported to have ever participated in any online teaching activity prior to quarantine. Zoom was the most commonly used platform in delivering educational sessions. Among barriers to online learning, 44% reported that they had difficulties, and most frequently encountered difficulty was the disturbance due to poor network connection, and it was 59%. Financial issues due to excess data consumption was 25%, and difficulty in adjusting to use software was 10%, and not owning any device was 7% respectively. Table 1 shows that 80.6% strongly agreed that online teaching was time saving, and 70.4% stated that online lectures were effective as traditional classroom teaching. Table 2 shows the distribution of agreement on overall impact of COVID-19 on medical education. Almost 2/3 noted that they found it difficult to concentrate on studies due to uncertainty of the exams. Furthermore, more than half confirmed that they felt the practical knowledge and skills are less due to the minimal clinical exposure. So in conclusion, most were satisfied with exclusive e-learning, and students' feedback can help the staff members to improve online learning experience for students. Thank you.
My study was on digitalization of Nutrition Month information system for children under 5 years of age in Sri Lanka. Nutrition Month was introduced in 2006 with a focus of assessing the nutrition of all under 5-year children in Sri Lanka to provide targeted intervention enhancing nutrition in vulnerable children. Annually, a set of data is collected from public health midwife level and reported by the medical officer of health level to the national level. This paper-based system had several issues related to data quality and increased workload. The objective of the study was to identify the need of having a digitalized information system to capture Nutrition Month information. Study comprised of 2 components. A focus group discussion was held with the health administrators and the national program managers involved in child nutrition. A descriptive cross-sectional study was conducted among all the 148 MOHs and additional MOHs in the Western Province. The results of the focus group discussions were prioritize anthropometric measures and demographic factors, especially the sector-wise data, implement the system with minimal disruption to the existing workflow, and to auto-generate the nutrition-related indicators. The response rate of the descriptive cross-sectional study was 86.5%, and 96.9% preferred computerization. Majority believe that digitalization will improve the data quality and reduce the workload of the public health staff. Most of them believed that the objectives of Nutrition Month could not be achieved merely by using the paper-based system and felt that aggregated data should be entered into the system at the PHM level. Thus, a web-based Nutrition Month information system was developed and implemented island-wide, which enhanced the timely decision-making and planning nutrition interventions. Thank you.
Polymerase chain reaction testing to respond to COVID-19 second wave, Colombo Regional Director of Health Services Area, Sri Lanka. Background. Testing is very crucial to understand the spread of the pandemic and respond appropriately. Hence, Epidemiology Unit of RDH Office has established a mobile COVID-19 testing unit to conduct systematic PCR testing. Methods. Mobile PCR testing unit tests the quarantine contacts and high-risk groups. The information of testing from October 1st, 2020 to 17th February 2021 was entered to the electronic database and summarized as daily average tests, test positivity percentages, and number of tests per case. Results. From October 1st, 2020 to 17th February 2021, a total of 64,217 samples had been taken. Number of tests done per thousand population was 35.3. Number of tests done per case was 16.9. Lowest average number of daily tests, 176, was reported in the second week of October 2020. Highest average number of daily tests, 700, was reported in the third week of January 2021. Test positivity had been 15.8% in the last week of October 2020 and it had come down to 5.8% in the third week of February 2021. In conclusion, with the systematic testing, quarantine and treating process, second wave of COVID-19 had been contained in Colombo RDHS area. Thank you.
Hello everyone, greeting you all a wonderful day. Today I am here to present you the topic of selected socio-demographic factors associated with food safety knowledge and practices of skilled children in Colombo Education Zone, Sri Lanka. Food safety as well as foodborne illnesses are two interlinked topics of interest spoken widely all over the world. It was found experimentally that almost 1 out of 10 people in the world fall ill every year after consuming contaminated food. Therefore, this study was conducted to assess and analyze the relationship between selected socio-demographic factors with food safety knowledge and practices of school children in Colombo Education Zone, Sri Lanka. Moving on to methodology, a cross-sectional study was carried out using 380 volunteer students of grade 9, 10 and 11 classes of randomly selected schools in Colombo Education Zone, Sri Lanka. Moving on to results and discussion, the mean food safety knowledge score of school children in the study group was average. When correlations between food safety knowledge score and demographic factors are concerned, significant correlations were found between food safety knowledge score and parents' education background, student science marks, and students' academic ranking. The mean self-reported food safety practice score of the respondents was satisfactory. However, students depicted poor hygienic practices with respect to proper heat treatment and proper food storage. Significant correlations were found between food safety practice score and students' academic ranking and student science marks. As you can see in the two figures here, man-Whitney U test indicated gender-wise significant differences in food safety knowledge and food safety practice. In conclusion, the findings of this study indicate that gender, academic ranking in the class, science marks and education background of the parents of the students have significant effects on the food safety knowledge and the practices. Thank you very much.
I am PPCM Chandrasena from BSc Nursing 12th Batch, Faculty of Allied Health Sciences, University of Sri Jayawardhanapura. Today I am here to briefly describe my study, Pursued Social Media Addiction and its Effect on the Well-being of the Undergraduates. Social media is a popular communication tool essential for connecting with friends and entertainment. The use of social media may have positive and negative effects on the well-being of the undergraduates. This study aimed to assess the association between the perceived social media addiction and well-being of the undergraduates in the Faculty of Allied Health Sciences, University of Sri Jayawardhanapura. Study designed a descriptive cross-sectional study setting second, third, and fourth year Allied Health Sciences undergraduates at University of Sri Jayawardhanapura. Study instrument, pretested self-administered questionnaire, data analysis using SPSS version 23. Based on results, the response rate was 79.5%. WhatsApp was the most frequently used social media. 39 students perceived that they have addicted to social media. There was a statistically significant association between perceived social media addiction and duration of sleep, activities of daily living, and study time. In conclusion, perceived social media addiction found to be associated with duration of sleep, activities of daily living, and study time. Proper awareness programs can be organized to understand the effects of the usage of social media on the well-being of the undergraduates. Thank you.
My name is Kandurat Nayaka, a medical student studying in the 2016 LL batch of the Faculty of Medicine, University of Colombo. I'll be briefing you on our study titled Reading Habits and Factors Associated with Reading Habits Among Medical Students at a University in Sri Lanka. Regular reading has been found to improve one's verbal and writing abilities, which may affect their academic performance, and reading may also influence the empathy of a person. The main objective of study was to assess the reading habits and factors associated with reading habits among medical students at a medical faculty in Sri Lanka. Our study was of a descriptive cross-sectional type, and we selected third-year medical students studying in Faculty of Medicine, University of California as our study population. A self-administered questionnaire was used to assess social demographics, reading habits, academic performance, and empathy. Reading habits was measured using self-reported habit index for reading and empathy using the interpersonal reactivity index. A total of 104 students participated in our study, out of which the majority were female. Main purpose for reading was found to be for exams, and almost all referred lecture handouts for academic reading spending the highest mean time per week. The preferred mode of reading was found to be from printed media, and majority preferred to read academic material at their place of residence. Majority read newspapers and fiction novels as material unrelated to medicine. A significant difference was found in the measured reading habit between males and females, and a significant positive association was found between total time spent on reading non-academic material with academic performance, but no significant association was found between reading and empathy. In conclusion, our study found that students read mainly for exams and referred lecture handouts for academic reading. Measured reading habits were significantly higher in females, and mean time spent on reading non-academic material was significantly higher in students with better academic performance. Thank you.
I'm Ruvini Senaratna, and my study was on e-health literacy levels of online health information seeking patients attending to the outpatient department of Dompe Divisional Hospital. To engage in e-health practices effectively, people need the ability to search, locate, understand, and use health information through electronic resources and use this knowledge to resolve health-related problems, also called electronic health literacy. This descriptive cross-sectional study was done in outpatient department of Dompe E Hospital, taking online health information seeking patients as the study population. Pre-tested self-administered questionnaire was used as the study instrument. Sampling technique was non-probability convenient sampling technique. Data was analyzed using descriptive statistics, and to calculate e-health literacy, Norman and Skinner's e-health scale was used. In results, 90% of the sample was below 45 years of age. Majority was female and educated up to GCE advanced level. Common online health resources were video sharing sites and social media. Top reasons for choosing those resources were convenience and easiness to understand. Mean value of e-health literacy score was 28 out of 40. E-health literacy score of majority was below the mean value. The last two e-heals items having reduced mean scores indicates participants having greatest difficulty in distinguishing quality resources and not confident in using online health information to make health decisions. Mainly in conclusion, majority had low e-health literacy. Thus, they have difficulty in identifying quality online health information, and this suggests the need of improving e-health literacy of patients to have better health outcomes.
Everyone, I'm RN Sevandi. I'm here to briefly describe my study, satisfaction regarding nursing care among patients with dengue fever in National Institute of Infectious Disease. Dengue is a mosquito-borne viral infection and it can cause lethal life-threatening complications. According to the WHO 2018, the incidence of dengue has increased 30-fold over the last 50 years in Sri Lanka. Objectives: to assess the satisfaction regarding nursing care among patients with dengue fever in National Institute of Infectious Disease. This was descriptive cross-sectional study carried out using patient satisfaction with nursing care quality questionnaire of 26 items among 330 patients who admitted to dengue unit at NIID. The data were analyzed using chi-square and descriptive statistics in SPSS version 23 software. Moving to the results, the mean age of the sample was 30.72 years and majority was male. Among the participants, 67.9% reported that they are satisfied regarding overall nursing care. The majority, 70.3%, were satisfied by the attention given by the nurses regarding the patient's condition. Patients' opinion regarding the number of beds and the number of patients in the ward were the main reason for the dissatisfaction of the majority. It was 82.4%. The chi-square test showed there was significant association between the length of hospital stay and patient satisfaction. It was 0.031 and available overall hospital facilities and patient satisfaction. It was 0.031. In conclusion, the majority of the patients were satisfied 67.9% with nursing care and were significantly associated with length of hospital stay, available hospital facilities. These are the references. Thank you.
Good morning, I'm Dr. Chamini Ranasinghe, and the title of our study is Knowledge of COVID-19 and Practices of Preventive Behavior among Medical Undergraduates, a cross-sectional study from Sri Lanka. The coronavirus disease has impacted globally, therefore accurate information regarding the disease, its spread, and preventive behavior is of paramount importance for containing the outbreak. The objectives of our study were to describe the knowledge on COVID-19 and practices of preventive behavior among medical undergraduates of University of Sri Jayabhadrapura. We used a cross-sectional web-based survey conducted in October 2020 among all medical students of the faculty. Data was analyzed using chi-square test, odds ratios with 95% confidence intervals, and binary logistic regression. Of a total of 426 respondents, 278 were females and 148 were males. Average age of respondents was 22.91 and majority were preclinical students. The mean knowledge score was 68.97 and based on that, 56.3% had good knowledge. More than 95% of students showed correct practices of preventive behaviors and females students had a significantly higher proportion of correct practices compared to males. Students studying in clinical years had discussed COVID-19 preventive practices with their family members and friends. Table 1 shows that being a female more than 22 years of age and studying in their clinical years were associated with a higher mean knowledge score, which was statistically significant. Moving on to Table 2, logistic regression on factors associated with good knowledge of COVID-19 showed that only the academic year was statistically significant. In conclusion, our findings reveal that although practices of preventive behavior were good, the knowledge on COVID-19 needs to be improved among all medical students, irrespective of gender and year of study. Thank you.
I'm WAPN Devasmika. Title is Groups and Antimicrobial Resistance of Uropathogenic E. coli from Humans and Companion Animals in Sri Lanka. This is the poster. E. coli has 8 pylogroups A, B1, B2, C, D, E, F and Escherichia clade 1. Uropathogenic E. coli are mainly B2. The objectives are to assess the prevalence of antimicrobial resistance in UPEC and to analyze the correlations of resistance to pylogroup and the host by ANOVA 2A model. In the methodology, the study used 104 UPEC strains, human 82, dogs and cats 22, isolated in microbiology laboratories at medical and veterinary teaching hospitals in Peradeniya and Batticaloa from June 2020 to January 2021. All isolates were screened by quadruplex PCR for pylogroup and ABST was done for 15 antimicrobial agents according to UCAS guidelines. In the results, out of 104, 74% belong to pylogroup B2. In ABST findings, the isolates were mostly resistant to ampicillin, followed by third or fourth generation cephalosporins and etc. There were 75 multi-drug resistant isolates. Out of them, 78.6% belong to pylogroup B2. There were 4 isolates in B2 that were resistant to all 3 carbapenems tested. This is a gel image of quadruplex PCR to determine pylogroup in UPEC. We can conclude that the resistance to cephalosporins showed a significant association with pylogroup B2 and the resistance to beta-lactams was highly significant in UPEC of companion animal origin. There is a widely distributed multi-drug resistant clone ST131 belonging to pylogroup B2 and it warrants further studies to determine this clone. These are the references for the study and the study was funded by NRC research grant. Thank you very much.
Hello, I'm Harshni Thabru. I'm here to present our audit on lateral flow assay and ELISA of galactomannan for serodiagnosis of invasive aspergillosis in cancer patients. This study was done at the Department of Medical Mycology, MRI, Colombo 8. Detection of antigens secreted by early sporulating hyphae has high specificity for diagnosis of invasive aspergillosis. Our objective was to audit the results of lateral flow assay and ELISA against culture and clinical and host criteria for EORTC for the diagnosis of invasive aspergillosis. Serum and bile samples were tested by lateral flow assay and ELISA, and the results were analyzed against the presence of host and clinical factors suggestive of invasive aspergillosis. Moving on to results, lateral flow assay and ELISA were both done only on 20 patients and 65% of them had host factors only, while host and clinical factors both were found in 15% of the patients. ELISA was positive in 100% of the patients who had both host and clinical factors, while lateral flow assay was positive in only 1 patient who had both host and clinical factors. Direct microscopy and culture failed to isolate aspergillus in any of the samples. Therefore, in conclusion, antigen detection by ELISA had the highest positivity, followed by lateral flow assay compared to conventional culture methods. However, this requires further study with larger sample size. Thank you for your kind attention.
Greetings to everyone out there. Hope you all are safe during this critical situation. Our research is titled as The Impact of COVID-19 Pandemic on Cancer Care, a descriptive cross-sectional study at Apeksha Hospital, Sri Lanka. All of us are widely aware that the COVID-19 pandemic has affected healthcare delivery throughout the world. The pandemic has made the delivery of care for patients with cancer during this crisis more challenging. Providing care in timely manner is very essential for patients with cancer in order to manage their disease and treatment complications. Several studies have highlighted the burden of cancer and cancer deaths by the year 2030, where they have predicted that the cancer cases may be increased from 14 million to 21 million, which is a 50% increase, while the cancer deaths will rise from 8 million to 13 million, marking a 60% increase. The study was conducted to assess the impact of COVID-19 pandemic on cancer care in Sri Lanka. A descriptive cross-sectional study was conducted among 225 patients with malignancies who sought treatments from Apeksha Hospital, Sri Lanka. Participants who were above 18 years were enrolled in the study using a systematic random sampling method, and critical patients were excluded. A pre-tested, interviewer-administered questionnaire was used to collect data, and the collected data was analyzed using descriptive statistics. The mean age of the participants was 42 years with a standard deviation of 14 years. Most of the participants were unmarried and feminine in gender. The most prevalent malignancies reported were blood, breast, ovarian, and cervical cancers. Majority reported that their treatments were delayed due to COVID-19. The perceived reasons to delay treatments are depicted in the graph. The conclusion of the study is highlighting the necessity of appropriate provisions to continue cancer treatment during COVID-19 pandemic. That concludes my short description, and thank you very much for your kind attention. Stay safe.
Knowledge, attitude, and practices toward COVID-19 among Sri Lankan undergraduates studying in countries affected by COVID-19. Introduction. Perceptions and behaviors of university students are more affected by COVID-19. The present study aimed to assess knowledge, attitude, and practices toward COVID-19 among Sri Lankan undergraduates studying in countries affected by COVID-19. Methodology. A cross-sectional study was conducted using an online self-reported questionnaire designed based on published literature. Sample size was 213. Snowball sampling technique was used and data were analyzed using SPSS software version 21. Results. Among the study participants, 36.5% were from Sri Lanka, 39.8% were from Russia, 23.2% were from India. Total scope on knowledge was ranged from 0 to 12. Mean COVID-19 knowledge score among study participants was 8.36. There was no statistically significant difference in knowledge among undergraduates with reference to gender, age, degree, marital state, or studying country. The total scope of practices was ranged from 0 to 7. Mean COVID-19 practices score among study participants was 5.59. Female undergraduates had a significantly higher practice score compared to males. There was no statistically significant difference in practice among undergraduates with reference to other factors considered. The attitude of undergraduates toward COVID-19 was satisfactory. And the study reveals that there is a correlation between knowledge score and the practice scores of the undergraduates. Conclusion. The study subject had good knowledge, positive attitude, and appropriate practices toward COVID-19. Thank you.
I'm Lishani Davarika, and our research topic is Effect of COVID-19 on the Economy of Tea Plantation Owners in Balangoda, Sri Lanka, and its association with their access to healthcare services during the lockdown. The COVID-19 pandemic has affected the economy of tea plantation owners in Sri Lanka and their access to healthcare services. So our research focused on these two effects of COVID-19 and to see whether an association between the two existed. This was a descriptive cross-sectional study where we selected 85 tea plantation owners belonging to a tea estate development society using simple random sampling. A self-administered questionnaire was used for data collection. The effect on economy was defined as positive or negative based on the change in average monthly sales, income, expenses, market price, and the number of key workers from March to August 2020 compared to 2019. According to our results, the majority of 56% had a positive effect on the economy. The most prevalent chronic disease was hypertension, and acute disease was common cold. The difficulties in accessing healthcare services during the lockdown, such as transport issues, unavailability of medicines, fear of contracting COVID-19, and inaccessibility of hospitals, was seen in 76.9% and 90.5% of chronic and acute disease patients, respectively. Transport was the major problem. Most of the patients who faced difficulties in accessing the healthcare services also had a negative effect on economy due to COVID-19. A statistical significance was observed between those with acute diseases who face transport issues and the negative effect of COVID-19 on the economy. So, in conclusion, it is clearly evident that access to healthcare services in terms of lockdowns should be made more effective. Thank you.
Hello everyone, I am Tarni Kumarisiri and welcome to our poster presentation under the topic of in vitro antimicrobial effect of Listeria sapium inner bark extractions against skin pathogens, a preliminary study. Throughout civilization, people have been using plant extracts as remedy for various diseases. Listeria sapium, which is known as Ladappa and Vatamara, is such tree locals used as remedy for skin wounds. So we have done our research to evaluate the antimicrobial properties of inner bark extractions against common skin pathogens. First, we collected the samples and air dried it, which subjected to two extraction methods. Hot extraction by decoction, which we then freeze dried. Ethanol extraction by cold maceration, which further concentrated by the rotary operator. Then we have performed agar-well diffusion assay against 80cc strains of Staphylococcus aureus, Pseudomonas aeruginosa, and Candida albicans. According to the results, both tested bacteria give inhibition towards both of the extracts. But in the case of Candida, it only gives inhibition towards the ethanol extract. Then we have done a statistical analysis to see if there's any significant difference in antimicrobial activity between the two extracts. In conclusion, Listeria sapium inner bark has potential antimicrobial properties against common skin pathogens. And there's no significant difference in antibacterial activity between the two extracts. But antifungal activity is higher in the ethanol extract than the hot water extract. So finally we can say Listeria sapium could be a potential source of new antimicrobial agents. Thank you so much.
Hello everyone, I am Priyamika Jayawardene. Our research was based on treatment defaulting in tuberculosis and to identify the groups at risk of defaulting. Tuberculosis is still a leading communicable disease which increases the risk of mortality and morbidity in those who are infected. Our research was a clinic-based cross-sectional study carried out in Colombo Central Chest Clinic using medical records of 542 patients registered in 2019. We chose the medical records by simple random sampling. The criteria of identify a defaulter was to select patient who has interrupted treatment for 2 months or more. We excluded patients following multi-drug resistant TB drug regime and those who haven't completed treatment at the time of our data collection. Our results were astounding. Our study had 68% males and 32% females, and treatment default rate was 20.7%. Being 30 years or more, being male, being a past or present smoker, being past or present alcoholic, past or present drug addiction has significantly contributed towards defaulting. Having pulmonary tuberculosis other than extrapulmonary tuberculosis is also a risk factor. However, being a bacteriologically confirmed patient has been a protective factor. So we came into a conclusion that 1 in every 5 patients who attends the Central Chest Clinic tends to default treatment. We should address this issue to optimize the treatment of care towards TB patients. Thank you.
I'm Jamini Kaushalya, Pre-Inter Representative Faculty of Medical Sciences, University of Sri Jawatanpura. Our research topic is, are patients with type 2 diabetes mellitus achieving therapeutic targets at tertiary care hospital during COVID-19? Experience from Sri Lanka. There is increasing evidence supporting hindrance in the management of non-communicable diseases during the COVID-19 pandemics. So, we conducted a clinical audit at University Medical Clinic and Endocrinology Clinic at Colombo South Teaching Hospital from February to April 2021. Moving on to the results, we recruited 941 patients. They had a mean diabetes duration of 10.41 years. Their mean fasting blood sugar level was 144.08 milligram per deciliter. They had a mean blood pressure level of 144/83. When we consider about the glycemic control, more than 36.56% had fasting blood sugar level of more than 140 milligram per deciliter, and moreover, 11.05% did not have fasting blood sugar levels within the past year. When we consider about the investigations availability, essential investigations such as lipid profile, HbA1c, serum creatinine and proteinuria were not available in the majority. When we consider about the blood pressure targets achievement, 67.27% did not achieve their blood pressure targets during the last year. So, the routine diabetic care has been hampered by the ongoing COVID-19 pandemic in Sri Lanka, and we recommend alternative methods of delivering care for the patients with diabetes during this COVID-19 pandemic. Thank you.
We welcome everybody. This presentation is related to wet-mounted toxic plants through trial and errors and future recommendations by Sammi Kaluarachi, Madhushan Aloysius, Ashan Vimukti, Nuravi Kaushalya, Lasantha Ranavaka, Sanjay Chandimal and Ishani Rangika, attached to the Department of Forensic Medicine, University of Sri Jayawardenepura. As per the introduction, Department of Forensic Medicine deals with the part of teaching related to toxic plants in Sri Lanka. Nowadays, it is very rare to see most of the plants by students because of the urbanization. To rectify this deficiency, we attempted to mount wet plants.
Moving on to the discussion, while going through the process, there were many difficulties faced, such as the perspex sheet was cracked due to the chemical and natural colors were faded. Anyhow, we were able to mount plants to preserve certain alternative characteristics. A method is also tried to preserve plants, that is dry preservation. As the conclusion, we hope to develop both techniques in future to have a more successful specimens. Thank you.
The clinical manifestations of dilophyllariasis due to dilophyllaria repens is believed to be confined to subcutaneous and ocular regions. However, it may not always be the case. Herewith, we present an incidental diagnosis of omental dilophyllariasis in a 46-year-old woman with diabetic nephropathy. She presented to the National Cancer Institute, Maharagama, after being extensively investigated for bilateral leg swelling and abdominal distension. Diagnostic laparoscopy was carried out to exclude primary peritoneal malignancy, and the histology revealed a worm within a granuloma. This worm had cuticular ridges, tall coelomyrian cells, and a prominent lateral cord. One of the uterine tubes contained developing eggs. Thereby, the morphology was compatible with female dilophyllaria repens. The peripheral blood was negative for microfilaria, and this patient was treated with half-dose diethyl carbamazine for 2 weeks of duration. Half-dose was administered due to the nephropathy. Since the ascites persisted despite treatment, repeat laparoscopy and infracoelic amentectomy was carried out. The repeat cytology and the histology were normal, indicating that we may have removed the worm within the first biopsy itself. The patient was referred for nephrology for further management. Dilophyllariasis is a mosquito-borne zoonotic disease mainly caused by Dilophyllaria immitis and Dilophyllaria repens. Dilophyllaria immitis visceralizes and is not reported in Sri Lanka. Sri Lanka, however, has the second highest case load in the world for dilophilaria repens. This is the first reported case in Sri Lanka for omental dilophilaриasis caused by dilophilaria repens. However, this diagnosis may not be the reason for abdominal distension after all in this patient, given the fact that ascites persisted despite treatment and the repeat biopsy was normal. However, this case serves as a reminder that dilophilaria repens has the potential to visceralize in the face of an immunocompromising condition, in this case diabetes mellitus. Thank you.